let's start back with the beginning of your diagnosis before your eye issues started.
Before the eye issues. Okay, so I had started having regular, what I now know was inflammation, but at the time it was just really painful.
Mm-hmm.
Pain in my sacroiliac joints and my neck. Actually, my neck was from when I was just a little kid.
Right.
I remember missing school when I was only 7 years old. I missed 3 days of school because I couldn't turn my head. And I remember you with extreme hip issues already in junior high.
Mm-hmm.
So by the time I was 18, I was having sporadic episodes with my sacroiliac joint on the right side, but I always found something to blame it on. I had moved a piano by myself, which I did, and, you know, stuff like that.
Yeah.
And with pregnancies, it got really bad. Like, I would have to do dishes in 10-minute intervals because I couldn't stand up for that long. It was too painful.
Right.
And I didn't know what was going on. I looked around, and everyone I knew, in my family, had a lot of back pain. So I just was like, I guess this is just how you live. I didn't know it wasn't normal to be in pain like that.
Right.
And so through my 20s, well, I should back up a little bit. When I was in my early 20s, I got mono. Mm-hmm. And after the mono, I could see just the sporadic episodes with my neck and with my sacroiliac joints.
Right.
Became more frequent. So the timeline changed, and it became more frequent.
Mm-hmm.
That I would be laid up for 2 days or 3 days, and then I'd be fine for months.
Right.
And then I'd be laid up for a couple days. Or anyway, that happened for a few years in my mid-20s. And then the year that I was 29, it became just body-wide and systemic really quickly.
Right.
I went from these sporadic episodes to the 2 years before that, when I was about 27. It started becoming 3 or 4 times a month that I would just be wrecked.
Right.
And you and I had done it together. We were runners.
Right.
We would run together, and I couldn't do that anymore. Mm-hmm. And there were things that I couldn't do anymore because it was just too painful. I just couldn't do it. And so, you know, I had gone from getting up at 5 a.m. to go and do a 5-mile run because I loved it, mm-hmm. to walking across the house was almost unbearable. Sleep didn't happen. It was too painful. You'd lay on one joint for too long, and then you couldn't move, and you'd have to change positions. And
I remember seeing swollen knees and swollen feet, toes on you.
Yeah, my kneecaps were so inflamed for 5 years you could not see them. You couldn't even see
and
kneecaps.
You have to have fluid.
Yeah, and the rheumatologist back then had actually drained some fluid off of my knees with a giant syringe, and then did a cortisone shot into them after he did that. Mm-hmm. That was fun.
Mm-hmm.
Not fun. And so when it became kind of systemic, I kind of likened it to being on the beach. Picture yourself on the beach, and you're laying on the beach with your feet towards the ocean, and the tide's coming in, and you didn't notice, and just the wave just starts with your feet and washes over you until it covers your head. And that's kind of what happened to me when it became systemic. I suddenly was having pain in my feet, and then the next month my knees joined the party.
Right.
And then it just all the way up until even my jaw. I couldn't open, my jaw locked down, and I couldn't open it. And all of these things were excruciatingly painful. And I can remember lying in bed and thinking, there's no way that anybody could be in this much pain and live.
Yeah.
How can you live if you're in this? I must have something really, really, really deadly wrong with me.
Right.
Because you can't, this much pain can't happen and you live through it. That's what I can remember thinking. And I just want to say, I had 3 kids without pain intervention, because guess what? In the state where I live, in the town where I lived when I was having my kids, no epidurals. Just saying. I can handle pain.
Yeah.
Right? So,
and
believe me, I wanted an epidural once I heard about them. They weren't available.
And then the process of trying to figure out what was wrong was not fun either.
It wasn't that bad, though, because I've seen a lot of people going through autoimmune diseases, and they're treated like they're some kind of hypochondriac, and
They're
not taking
happen.
that did not that ne- I
It was
never
just
went
hard
through
to
that.
find out exactly
Right.
what was going on.
Nobody could call me a hypochondriac when you walk in there and they can't see your kneecaps.
Exactly.
There's something really wrong.
Right.
So they started the testing right about Christmas time in 1996. So by the end of March, I was diagnosed. So it really wasn't that long. It just felt long at the time because I was in so much pain. And I was so sick, and I was having fevers, which I still have.
Right.
You know, just for no reason, I'll have a fever.
Right.
So in March of 1997, so now everybody knows how old I am. They did the math. My great rheumatologist, he's a fantastic rheumatologist, great doctor, compassionate. He was just so fantastic. I really was blessed to have the doctor that I had.
Yes.
And he diagnosed me with what he called an undifferentiated spondyloarthropathy. It is an actual category in the ankylosing spondylitis, psoriatic arthritis, that family of autoimmune diseases. And he put me there because I had all the testing. My SED rates were whacked out. My HLA-B27 positive test. I was positive for that in that test. But I had no fusing. They did x-rays and there was no fusing. And still, now, there's no fusing. So, but I remember when I got that diagnosis, of course, it was a Friday. And, you know, the internet was fairly new. I had only had my own PC. I mean, this is 97. We're still running Windows 95.
Right.
I mean, this is how long ago this was.
Yeah.
This was when I thought a computer with 4 gigabyte hard drive was just massive. I was just going to lose things in there. I don't know if you remember that. But anyway, Windows 95, crazy times. But I remember immediately when I went home and did the little search, and it wasn't Google. It was something else. Some other search engine back then. I think I used Dogpile. I think that was the search engine I used.
It was the search engine.
And I researched it, and of course the weekend's coming, and I can't ask the doctor any more questions, and I'm not going to see him for a couple more weeks to talk about treatment, because this was just I went in to find out what I had appointment.
Right.
And every symptom, I looked at ankylosing spondylitis, and every single symptom was you. I had watched you my whole life. And I remember calling you, and I'm like, Kathy, you have this. Do you remember that?
Yeah.
So my diagnosis made her diagnosis
much easier
and quicker. Like, they just started with that. And immediately on x-rays, you had 10 years prior, they found fusing in your sacroiliac joints.
Right.
Like right away.
Yeah.
And so they knew you got the ankylosing spondylitis. I have the cousin, undifferentiated spondyloarthropathy, maybe ankylosing spondylitis, but I got treatment, and I've had really good treatment, and fusing has been, it's been slowed.
Right.
So in that amount of time, I have had 2 joint repairs already, though, because I've had a lot of inflammation in the joint, and a lot of my inflammation is in connective tissue tendonitis. They call, what is that, enthesopathies, where there's inflammation at the point of tendon attachment into the bone. And my biceps tendon on this side actually ruptured. Yeah. It ruptured, and they actually cut it off and reattached it down here in the bicep. So that was my first joint repair.
You have a lot more soft tissue damage
than
I've had.
And
which also
when
relates to your eyes.
Right. And when it's inflamed for years, you're just a rupture waiting to happen.
Right.
I also ruptured my plantar fascia in one of my feet. That took 2 years and a great podiatrist to heal. I was really grateful that I went to a podiatrist that didn't jump straight to surgery.
Right.
He had a lot of methods that my feet had been in pain since I was 20. And this guy got me out of foot pain, and it took 2 years, and I argued with him. I did. I was like, this is not working. He said, would you just trust me? And you got to be willing to have a relationship that's give and take with your doctors. If you don't like what he's saying, don't necessarily walk out, have a conversation.
Right.
Because most of them went into the business because they wanted to help people. Most of them. So anyway.